Today, I'm going to talk to you about a very important topic, reclaiming your vagina. Yes, that's right. My name is Dr. Tiffany Dillard. I am a board-certified OBGYN specializing in gynecologic surgery, and I'm also a menopause specialist. Today, we're going to talk about vaginal dryness. To share some general information about menopause, I want to remind you to go and see your doctor and talk to them about the information that you are hearing on this video, and make sure that all of the advice is tailored specifically for you. Now, let's get to it. So, reclaiming your vagina. What do I mean by that? Specifically, I mean we want to address the vaginal changes that occur during perimenopause and menopause. There is a broad medical term called genitourinary syndrome of menopause that encompasses these changes. It encompasses vaginal changes or genital changes, some sexual changes that occurs with that genital urinary area, and urinary changes. Today, we're going to talk about specifically the vaginal changes in the form of vaginal dryness. Vaginal dryness is a very real problem for many women who are transitioning through perimenopause. What oftentimes women will find is symptoms occur slowly and can eventually get to a point where there's a lot of pain in the vagina, and it can make it where sexual intercourse is basically impossible due to pain and narrowing of the vaginal canal. So, what's happening? Well, as we go through menopause, we know that estrogen levels decrease. And as estrogen levels decrease, so many areas of the body are affected. Almost all areas of the body are affected. But how is the vagina affected? Well, let's talk about what happens in the vagina before. While you have normal, beautifully circulating levels of estrogen, the vagina is very well moisturized, very well lubricated, and has lots of folds and grooves within it that we call rugae. As you're progressing through menopause and estrogen levels decrease, those folds start to flatten, and we call it vaginal atrophy. There's less lubrication, there's just less moisture, a feeling of like sand or sandpaper. You might notice that sexual intercourse is very uncomfortable, that it's hard to even begin to penetrate the vagina just because there's no slip to it. This needs to be addressed. You know, as we enter perimenopause, ladies, we're in our prime. There's no reason why we shouldn't have functional vaginas. We want functional vaginas. So, what can we do about this? How do we treat it? Well, in initial stages, the first line of treating the symptoms of very dry vagina is a vaginal moisturizer. If you go to your local pharmacy drugstore, you can find a variety of vaginal moisturizers. A very common one is Replens, Vagisil, Luvena. I'm sure that the pharmacy itself probably has a generic version of the above, but you go to the feminine product section, and any of the bottles or items that are called vaginal moisturizers, that's what you want to try. That can give some just relief to that dryness, adding a little moisture back to the vaginal tissues. This is great to use for ladies who are first noticing these symptoms and just need a little bit extra help. Besides vaginal moisturizers, if you're having some sexual symptoms with it, vaginal lubrication. Lubricators. A lubricator is different. Lubrication is different than a moisturizer, but lubrication can be used. But we're going to stick a pin in that because part of this whole genitourinary syndrome of menopause, big word for what we're saying, is not just vaginal symptoms, like we said, but sexual symptoms. So we'll stick a pin in the lubrication and urinary symptoms. What else can we do? Another line of therapy would be to use hormone therapy. So the gold standard of treatment for vaginal dryness is vaginal estrogen. And estrogen for the vagina can come in the form of cream, pill, ring, suppository. Now, I'm talking about directly applying estrogen to the vaginal tissue, not like a patch on your skin or a pill that you take. That's not what I'm talking about. Those other methods of giving estrogen back to your system can be really good at helping with systemic complaints, hot flashes, night sweats, etc. But specifically for the vagina, in my experience, getting right to the point of issue, a problem, is typically the best thing to do in my experience. Any of those forms of vaginal estrogen can make a huge difference. Once you've been using them for anywhere to 2 to 4 weeks even, you'll probably notice a big difference. For optimal relief, you get up to 3 months. But before 3 months, you should start to notice a difference, an improvement in the discomfort, improvement in the moisture of the vagina. Now, some of you are saying, well, I've had breast cancer, or I'm just freaked out about hormones. I don't know about it. What I can tell you is this, and once again, you have to talk to your own doctor, but when estrogen is given through the vagina, it is absorbed in the system, just like anything transdermal or, through the mucosa is, but it's absorbed in very minimal levels. So the amount of estrogen that is found systemically when vaginal estrogen products are used still falls within the range of normal menopausal levels of estrogen. It doesn't kick up that level of estrogen higher. For those who are even more concerned about that, there are different levels. There are different kinds of products that might have a little bit more or fewer micrograms of estrogen per application. And that might provide you some comfort in thinking, well, I want to use it, but I want to use just a little minimal amount. Fine. There is no evidence that using vaginal estrogen increases the risk of breast cancer. And there's no evidence that it increases the recurrence risk of breast cancer or any other gynecologic cancer. There just isn't evidence of it. So, for those of you who have experienced cancer or who, you know, are very concerned, and if you're the person who feels like, you know what, if I use this vaginal estrogen and I get breast cancer or I get a recurrence, I'm just going to be convinced that it was because of that vaginal estrogen. In my advice, don't use it. In my opinion, don't use it, because if it should happen, you would hate to be left with a feeling like there's something that you could do to prevent it. When honestly, in actuality, it likely was just going to happen anyway. But there's a lot to be said for peace of mind. So that's my 2 cents on that. Now, and of course, once again, please talk with your doctor about it. But vaginal estrogen is a wonderful way to treat vaginal dryness. There are other products. There's vaginal DHEA that can be used. A lot of folks like the idea of that. That's a steroid, but honestly, once it gets intracellular, it's converted, it's aromatized into estrogen. So I'm gonna leave it at that. But vaginal DHEA is another treatment that can work really well for the symptom of vaginal dryness. There's also vaginal rejuvenation. I know some of you have probably heard about that. That's when a CO2 laser is used to resurface the vagina. And in doing that, it's supposed to help with renewing, kind of refreshing the cells down there, and a lot of women have said that it's provided relief for them. On the other hand, there are some that felt like it contributed to some more scarring or fibrosis, but that's something for you to explore. So, that's kind of the beginning of the discussion. Now, you know, with this vaginal dryness, and maybe we'll hold off until we start talking about sexual symptoms, because and sexual changes. Let's do that next time. I'm gonna end it there. So, I hope that you've learned something here. I hope I've given you something to talk about. Talk about it with your girlfriends, with your friends, with your husband, with your partner or spouse, life partner, with your fling, child. But talk about it because there's no need for us women to just live in silence with pain in our vaginas. We shouldn't have to do that. We should be able to tell our loved ones or the people that we are intimately involved with that this is a problem so they can have an understanding and be more caring and understanding to the issue that you're going through. There's no way that your partner can be understanding of a problem that they don't know exists. So please talk to your partner about it. Talk to your doctor. There's treatment. Let's reclaim our vagina. Let's be rejuvenated as we're progressing through these perimenopausal years. I can guarantee you your vagina will thank you for it. See you next time.